There's no one particular age of patient who is afflicted by hemorrhoids. However, most commonly, hemorrhoidal disease begins to manifest itself beginning at around age 40 and extending on through adult life. Why do they get hemorrhoids? We don't know. We can fix them, however, when they become symptomatic and are no longer responsive to local medical measures such as creams, stool softeners, and the like. The way to fix these things is either to remove them, which is the traditional hemorrhoidectomy, which is extremely painful and involves a long recovery time, or with some of the newer techniques such as PPH, which is procedure for prolapse and hemorrhoids, THD, which is transarterial hemorrhoidal dearterialization, or several other techniques that are in the process of being developed. The concept is with PPH that the hemorrhoidal tissue is pushed back to its normal position and then the excess tissue is removed. This allows for a little bit of hemorrhoidal tissue to remain, and this adds to the comfort patients have when they have bowel movements because the hemorrhoidal tissue acts as a cushion. THD simply cuts off the arterial blood supply to the hemorrhoid, effectively allowing it to wither away, and at the same time returns the hemorrhoid back up to its normal position. But all of this is done without cutting. Both the PPH and the THD are performed in an area above what we call the dentate line. Above the dentate line, there are no classical pain fibers, so the procedure is much less uncomfortable after the operation and allows patients to return to their activities of daily living much quicker. A traditional hemorrhoidectomy is much more painful post-operatively because the operation is performed both above and below the dentate line and affects the nerve endings that control pain.